We want to welcome you into another week of coronavirus inside the Arizona numbers. And a big headline I want to get to right away. We are expecting Governor Ducey to meet with the media in about 90 minutes. So at 3 this afternoon, he's going to be joined by leaders from hospitals and pharmacies and public health and also some universities. And really what they're going to be talking about is some additional actions to increase flu vaccination rates this year. Obviously, this could get very confusing if people don't know if they're sick with the flu or sick with COVID. So they really want to urge Arizonans to get out there and get the flu shot. And that information is going to be coming up at 3. I want to let you know it's going to be live on ABC 15. If you want to watch it on TV, they'll have it right here on abc15.com or on our Facebook page, all of our social media channels, so that you can catch what the governor has to say in about 90 minutes. But we'll make our way through this afternoon here with all of you, helping you find the best data out there to make the best decisions for your family. You know their health and their lifestyle best. We're just here to help you find the data that surrounds that so you can make the best choices. And for a Monday, there's a lot to get to today, Garrett, but let's start on that summary page. A few things to talk about. And I do want to note, over the weekend when we were not with you, we did pass that 6 million mark of cases here in the United States. So just for perspective, 6 million in the US and 200,000 of those cases right here in Arizona. So Garrett, on that summary page, how do things look today? Obviously, a Monday is a little bit lower in reporting.
Monday is always a very low number, and today is no exception. As you remember, we passed the 200 threshold last week, so 201,000 is our total. 5,029 deaths. We did surpass 5,000 early, I think it was Friday or Saturday. The number of cases today, 174. That is the lowest number of cases reported by the state since April. And again, just remember that these numbers these are not coming in from the last, well, actually now they are coming in a little closer to the last 48 hours. But, the Monday reports are always low because a lot of the counties are not processing reports. People are also just not going and getting tested on weekends as much as they are, so as much as they used to. And of course, we have to talk about this number, -1 number of deaths reported today. That was a withdrawal of a death that occurred the death still likely occurred, but the death certificate was withdrawn from the COVID EpiCurve sometime in July. Other than that, as you can see, very low numbers. The number of PCR tests were about 5,000, a little over 901 serology tests. All of the percent positives today were very, very good. All of them were under 5%.
That's great news. A couple comments coming in. First of all, Monica writes, so glad I caught you two today. I've missed seeing you this past week. Wondered if you were still on. So glad you two are a part of my trusted resources. Monica, thanks for joining us again. Yeah, we have so much to talk about today. So we're glad you're able to join us today. Garrett, as we look at those numbers, obviously there's a few things of note. That -1 in the death category really could only most likely happen, I should say, on a Monday, because we have those lower reporting days. We might see it next Tuesday, maybe after having a holiday weekend where those numbers are lower. But that means that some were taken off. Were there any deaths added? Had you clicked through some of those counties to see if there were any added?
Yeah, I don't think so. No, today was actually a very interesting day. There wasn't any deaths added. It was just simply one taken from Maricopa County. Now, I know people look at this, and I know that there's been some circulation this weekend about something involving the CDC and these death certificates. And what you need to understand, of course, is that these are when we see this data, a lot of it, especially most recent data, all of these deaths are done through certificate surveillance. So they are basically going out and checking codes all across the hospital systems, all across the county medical examiners. And then after they're checked and they get a large number back, they then go by and investigate these death certificates one by one, so that you can basically see, or so that they basically verify that these numbers are correct. And what they're doing is, today, since the county they didn't do a death certificate surveillance, the county medical examiners, for the most part, are not doing administrative services. So, but you do have some people doing investigative work. And so they did find one death certificate that was withdrawn.
Okay, so Garrett, we're going to get to a subject that a lot of people were sharing information about, and we're so thankful, first of all, to have you as a data analyst to help us better understand these numbers. Because sadly, and quite frankly, a lot of TV stations don't have someone like you on their staff able to help everybody better understand these numbers. And this article was shared and shared and shared this weekend, and it talked about comorbidities. And the big number that everybody was pulling off that chart was 6% and 94%. So this is a national look that came out from the CDC. Let's talk about that. Let's also dive into Arizona numbers. And I know that we only get those specific numbers from Maricopa County, but it's very telling in how we had a little more time here in Arizona to get our reaction in response to COVID-19 in place, to be able to save lives. And that does show up in the numbers, and that does show up in the comorbidities. Can you walk us through, first of all, where to find this on the Maricopa? I'm assuming that's where you'll go. That's where I went.
Yeah, I'm going to go to there. But yes, exactly. You're exactly on the right track. They when they put out that number, that 6%, this is exactly what I just talked about. This is a death certificate surveillance, and what they're saying is that only 6% of the death certificates had just COVID-19 as the cause of death with nothing else. Now, that is basically implying, of course, that COVID-19 is akin to a terminal illness such as a cancer, that people would just die from COVID-19 and nothing else. But we do know, and this has been no secret since this very beginning, that COVID-19 is a respiratory disease that does also it can affect cardiovascular function and all these other things. So people do not die of COVID-19. They die of a heart attack. They die of pneumonia. They die of a bunch of other stuff. So, this has not been a surprise. I mean, people saw this weekend and said, oh, look, this whole thing has been a lie or whatever. And no, we've always known this. This is not something that came as a surprise to anybody. So we do have Maricopa County, and this is the best thing we have right now. For Maricopa, and we only get it from Maricopa County. They do give us some risk factor data. You can see right here, this is all, you got to put your line right here between the ages and the chronic medical conditions. And what this is saying is that in Maricopa County right now, 51% of the deaths that have been marked COVID also came with a chronic medical condition. And then the highest risk, 65 years and up, that's 83% of the deaths so far have been basically tallied, have come from either people who are a chronic medical condition or 65 years and older.
So when we're seeing that national percent of 94, it compares to half of Arizonans who've died of this.
Yeah, I mean, again, this is what we have here to look at. We just have, all we know is that with Maricopa County, that they say that in 51% of death, that there was a chronic medical condition. Mm-hmm. Now, as far as what chronic medical conditions, they are here somewhere, but I have to look for them. But it does basically, that's what we have from them.
It tells quite a different story than what it does nationally. And I know a lot of people were sharing that and saying, aha, this is something that you and I have talked about all summer, and shared this particular page on this sheet and have explained this to folks here. And also reminding people that there are like 4 lines on the top of a death certificate that can be filled in. So think of someone that has dementia, and it causes them to not know where their home is, or to wander outside of their home aimlessly. And they go out and they die of dehydration because of our hot Arizona weather. Both of those things will show up on their death certificate. So it's not a one or the other situation. There are at least 4 lines up there that can be filled in for what takes a person's life.
Yeah, look, I'm not going to sit here and listen. You say this all the time. We don't tell anyone to what they should do and how they should live. We're just telling them how to interpret the numbers. And what we can tell you is that, as far as we can tell, this has been no surprise. This was added to the CDC, but we already knew that deaths from COVID-19 also came from pneumonia, came from a heart attack, came from something. We already know that we have an increase in deaths in Arizona. We have a 61% increase from July. So they came from somewhere. They came from COVID right now. That's all we know. That's all we can assume. And after about a year or so, when we actually have cause of death data from the AZDHS, then we can look at it and analyze a little more. But this is where we are right now.
Yeah, and data is always fluid. As we get more information in, we can make better decisions. We just wanted to show all of you where to find this. So when you're seeing this article shared from a number of different places, and be sure to really look at that article critically, because not everybody has somebody like Garrett, a data analyst on their staff, to help better read this information. Look at it critically and then compare it to Arizona's numbers. For those of you who are here in Arizona, I know many of you are watching from Arizona. If you're watching from another city, hopefully your county or your state puts out information that is just as good as what we get from Maricopa County. Garrett, do you know, as you're looking at 15 of the other Arizona counties, have you seen any that are giving us that kind of comorbidity information like Maricopa County has volunteered up for all of us?
No, I have not seen any of the other counties giving as rich of a data set as Maricopa County does.
Yeah, it's so helpful. And obviously it's our most populous county. It's the 4th most populous county in the US as well. So it's really good information. We just wanted to share where all of you could find it. A lot more information on that page as well. All right. The response to this fire. Oh, good job, Garrett, Audra writes. Thank you, Audra, for joining us on here. And let us know if you have questions about where to find some of the information. We can also help you find this so you can be better educated in your decisions out there. All right, our RT, our R not. We are back in the #1 category for the state of Arizona for our response to this and how quickly things are spreading or not spreading in this case. Back in the #1 place, aren't we, Garrett? And it seemed like we had a few more join us.
Let's see, did I lose you? I think I lost you.
No, I just stopped so you could
okay.
Got
you back. Okay. Yes, we are back in the #1 spot. I've got this pulled up here. Let me get it to darken the reader so you can see it. Here we are. We do have we are at a 0.85. Our error bar is ever so slightly above 1 at this point. But for the most part, it is almost all under 1. And you can see, again, best in the country right now as far as today's estimate. We go all the way up to 0.99 with Kentucky. And then here at the top end, South Dakota at a 1.36, North Dakota 1.26, Iowa at 1.25, and then Hawaii right here at 1.15. So a lot of Midwestern states up here at the top. And then, of course, Hawaii. We know that Hawaii's got a very low case count, but it has been rising a little bit. So.
All right. Thank you, Garrett. We wanted to continue tracking that. Our error bar is above the 1 for part of it. Not anything to worry about necessarily when we're definitely in that top spot. We're in really good shape at this point. One of the other things we want to talk about is the bars and restaurants that have been reopening. And we wanted to update you. Everybody on here, a lot of people were saying they were concerned all these places were opening up. Obviously, they're still limited to 50% capacity and limited to making sure that everybody's safe as they come in, trying to protect their staff and also their clientele. The state has already found 3 places that they say are not in compliance and have already asked them to close indefinitely. That's Casa Amigos in Scottsdale, Bottled Blonde in Scottsdale, and then Glow Shots and Cocktails in Tempe. Those are the first 3 that we know of that have been shut down. So we wanted to update you on that as well. They are working to crack down on this. They're not just letting people open as they were in June and May. One other note, ASU and U of A, we've been tracking their numbers as they come out, and we can also tell you that NAU starts today. So we'll see what kind of information we get from them. Garrett, have you seen any updates on the numbers specifically from ASU and U of A? We were tracking that, and I know over the weekend they had a few more numbers come in that they wanted to update everybody on.
Let me look at U of Arizona. I'm looking at ASU right now, and I only see something as of August 27th. So I've only seen that 452 that has been produced. They did use they used sort of a fudgy percent positive in their number that probably wasn't appropriate. They should have done the number of tests to the number of cases to the number of tests, and what they did was the number of positives to the number of population, to the number to the super population. So they probably should have been a little bit. I don't want to say it's dishonest, but it's not as accurate as it could be. So
yeah. Kim was asking, has Pinell County met all 3 benchmarks? I'm assuming you're asking for schools because you're saying 3 benchmarks. I'm not sure if you're asking for schools or businesses. But at this
I
point,
don't believe so. No, we were looking at that this week. Yeah.
Yeah, they're still in the substantial category, Kim. Thanks for the question. Still in substantial category. We will have the recalculation that comes out on Thursday, so we'll keep you updated on that. Oh, Brian's asking a really good question. Any numbers, any number info for GCU? I have not seen that yet, and that's worth us asking for.
Yeah, it's definitely worth asking about. They are private institutions, so they don't have to have the same reporting requirements. But
I'll ask just in case anything's been volunteered, Brian, when we get back to the newsroom for you. I have not seen anything on that. So, oh, Sheila writes, thank you for coming on here every day to share the data and putting up with a lot of negativity from people. Sheila, thanks for saying that. We do read all the comments. And I have lived in Arizona for since 5th grade. This is my home. Garrett, how long have you lived here? You've been here
about 12 years now.
Yeah. I've been here since I was a kid. So when I see hurtful, mean, let's put it that way, comments on there, this is my home too. My family lives here and I want them to be safe as well. So that's why we spend a lot of time going through the numbers. I have to make the best choices for my family, and I trust that all of you will do the same for your family. So we're just here to provide the data so that you can do that. We're not here to make those choices for you. So Sheila, thank you for saying that. That means a lot. If there's one positive comment in all of the negative, that's enough to keep us going. So thank you. Let's see some of the other info. And for those of you who are joining us late, I want to remind you, 3 p.m. today, we are expecting to hear from the governor. So 3 p.m. today, we'll carry it live on all of those places, all right here on Facebook and also on ABC 15 and on abc15.com. So wanted to keep you updated on that. How are our hospitals doing, Garrett? It seems like they're getting a handle, but I know a lot of our healthcare workers are nervous that now that everything's starting to open again, that it's going to get busy for them. And they've just gone through a lot, not only physically by working long hours, but mentally and emotionally, because they've had to try to save lives and they're watching people die right in front of them. So we obviously want to protect them as well.
Well, so far, hospitalizations have been definitely still appreciably smaller than they were, and the trend continues, which is always nice to see. I've got it pulled up. We'll start with just the COVID-19 numbers. You can see it did increase a tiny bit from 757 to 768, but I hardly call that an increase right now. That's more of a just a holdover from the day before. So we'll see what happens tomorrow. But these are numbers we've seen. This is early May numbers, as you can see. I mean, we're at the point where we're right here in sort of early May with our inpatients. And ventilators are the lowest they've ever been since reporting began. With the exception of this one number at April 8th of 133. But because of this jump right here, I tend to think that this is more of a reporting issue of one hospital system not being online. So realistically, we are likely at the lowest ventilator use that the state has ever been. ICU numbers, a small decrease, but still the trend line continues down at about the same rate it has been. Discharge number was very low today, but of course, when you have less people in the hospital, you're going to have less discharges. Emergency rooms, this one's interesting. I always find this one interesting because it's the only one of the graphs, the hospitalization graphs, to demonstrate a slowing. You can see it really picked up. It was really high. It started dropping, and then all of a sudden, it's sort of going gradually down. Now, this is an interesting metric. It's not a bed count like the rest of them. The inpatient is an actual bed. The ICU is a bed. The ventilator is a bed. This is emergency department visits. So this could be more than one person. I mean, the same person or peoples could have shown up at the emergency room that day on the 26th and the 30th, and they would be counted in this graph. So there might be some people that are sort of, causing this graph to slow down a little bit more than others. And then intubations, a low point as well, 53, sort of where we were again in May. So, and as far as the actual hospital census numbers, you can see that the hospital numbers, at least the ICU, we're down to about 77% usage across the system, with really only 15% being COVID-19 at this point. And then inpatient, same type of thing. We're only 10% of the population of beds we have are COVID-19 patients. So they're not really they're not really causing stress on the hospital at this point.
Yeah, some good news for our frontline workers, our healthcare workers. Martha is asking about the numbers in Yuma. I'm thinking the best way to get that for Martha, either looking at the county when we go through ACDHS. What are you thinking, Garrett, for an update?
Yeah, we'll go to that. I'm going to look at what the percent positive was today too. If you just give me a second.
Yeah.
Yuma's been one of those where it has a fluctuating percent positive. It's because it doesn't do as many tests as, say, Maricopa County. So actually today, Yuma had a quite high percent positive. It was about 10% of the tests that came in Yuma today were positive. So let's just look at the demographics number. I'll pull it up really quick. Here we go. There it is. And here's Yuma. This is the number of cases. Actually, we're going to go to cases itself. Sorry about that. That way we can sort of see what the curve looks like. You can really see what I'm talking about with those percent positives, how there's really these jumps. Really, it's not as smooth as some of the other curves. Definitely went very high, but there's all these sort of large jumps where it's 56 to 86, back down to 51, but as you can see, definitely a measurable slowing here. Absolutely.
So, Martha, we hope that helps to help you better see how Yuma is looking, and also, as Garrett mentioned, just watch for those anomalies. So don't get too happy if you see it real low, or too worried if you see it too high. Sort of look at that whole graph right there, because it's going to give you a better understanding of how things look. And we'll continue to keep Yuma updated on here. Roger was also saying he just lost his neighbor to COVID. So first of all, Roger, we're so sorry for your loss. I know that it's such a hard thing. I have not lost someone personally, but my family has. And so I know how difficult that can be. So thank you for taking the time to join us on here as well. Let's see, Garrett, when we talk about these numbers, and I know you posted it as well this weekend as we passed some major markers here in Arizona. We had passed 200,000 cases as we predicted last week, and then 5,000 deaths. A lot of people were writing back and saying, but what about the recovery? So there's no actual place to go for a set recovery number, but you have done the math for us to help everybody better understand how that looks. What is the range for recovery that you suspect that we have already?
So basically, we're looking at anywhere from 180 to 190,000 of all of these cases are already way past in infection at this point. So really only about 11 to 21,000 cases in Arizona are probably infectious. And it may even be lower than that. I mean, there was a very interesting article at the New York Times this weekend that talked about sort of the sensitivity of the PCR tests and how they can definitely pick up sort of traces of the virus even as far as 30 days from when the virus was actually active. So, and I don't know the cyclical thresholds that are being used in Arizona to see how sensitive our data is, but basically we're taking this what the gist of the article is, we're taking this very complex test and how you can sort of tune the sensitivity of it. And we're boiling it down to basically what's called a binary, a 0 to 1, yes or no, as far as positive or negative. And what that means is, without knowing when the test was taken, and most people only just take one test, we don't actually know if that positivity was found either at the beginning of the infection. Obviously, the middle of the infection would be the easiest because the viral load would be so massive. But then at the end of the infection, the viral load would also look very similar to what it did in the beginning in the infection. So this is where one of those things where we know that as far as our yes-no number, there's about 11,000 to 21,000 active cases that could be in Arizona. But that number, it could also be, exaggerated because we don't know when these tests were taken.
Oh, that's interesting. That's interesting perspective on that. But it's got to be a better news. I mean, I know that the range can still feel large to some people when it's 11,000 to 21,000 active cases in Arizona. But I mean, obviously, it's better than the
20,000. And realistically, it's probably closer to the 11,000 because I use that range because the Coconino County is the only one to sort of give their methodology on how they perceive a recovered case. And that what they do is the case has to be older than 28 days. Right. And obviously the case could not pass away. So I'm using that. I'm using the 14-day threshold because that's the more common. And I'm also using the 28 to sort of give a range. Yeah. But realistically, as far as an active case is concerned, it's more likely that it's in that 11,000 range than it is the 21,000, because that's the amount of cases that we have that are under 14 days.
Yeah, really good news if that's the case. Brian Tammy, just a little bit ago, Brian and Tammy, I think is the name on the account. He was asking, or Tammy was asking, not sure which one of you is posting, about GCU. So producer Josh behind the scenes just got a little more information about GCU. So Brian or Tammy, if you're still here, basically there's no dashboard over there on GCU's website, but the last news release that they sent to us, producer Josh says it was sent on August 13th. And really the only thing they sent in that was sort of pushing to a video that talks about their reopening experience. And they were talking about all that they were working on to protect their kids, so that the masks would be required, social distancing, no guests on campus. That's similar to what we're seeing at ASU. And then they're following a blended learning model. So the classrooms, if they're used, they're only going to be 40 to 50% capacity. If we see some of the data come out of there for you, we'll keep you updated on that. But that's how things look out of there. And if you're asking about MCC, Mesa Community College, I saw somebody post about that a few minutes ago. Classes started August 22nd, but most of the facilities are remaining closed. So it just varies by campus what they're doing. And then they're offering the same kind of learning that we're seeing across Arizona. Online, hybrid, that's Maricopa Community College. Online or the hybrid. So it's kind of similar across the board. If we see specific numbers for those places, we'll keep you updated on that.
And then go ahead. I'm sorry, I apologize, but I must call out Miss Lydia Rayleigh for saying that hospitals are getting paid if you die with COVID. Yeah. That is simply not the case. It is not a lie. It is not a case. What is happening, and this has sort of been twisted over time, is that the CARES Act does provide money for treatment for treatment for hospitals that are taking in uninsured or Medicare patients for COVID-19. For some reason, that got sort of twisted into that a physician could just sign a death certificate as COVID-19 and the hospital would get paid for that. And there's obviously problems with that. A, if there's no treatment in there, then you can't just get paid for a death. It's not a bounty system. And B, you're now asking a doctor to basically upcode and possibly lose their license in a subsequent investigation in order to provide money to a hospital. And it just, none of that makes any logical sense. So I know that people are thinking this, but it's really been sort of, it's a myth. It doesn't happen the way that it's being told.
Some of those fact checker and Snoop's websites and things like that have a really good explanation of how that breaks down. So if you're interested in getting the truth on that, you can find that over there. One other person wrote, Brenda was writing something about a friend who had a heart attack. Let me see if I can find Brenda's comment. Sorry, so many of you are posting so fast. She knows someone who had a massive heart attack, no underlying causes, marked as COVID on death certificate. So you'd still see the heart-related item on the death certificate, Brenda, but you're right. If they're in Arizona, if they're in Maricopa County, they are going to go test them for COVID because that can show up as a cardio response. I had a friend also who had a family member who had a massive heart attack with no underlying conditions, and they tested him, and he indeed had COVID. So we can see that show up as we did in that Broadway star who started losing limbs, and we were seeing the cardio reaction to the COVID in his body. So very, very similar thing. If you die of something unexpectedly, they're going to test to make sure that to find out for sure if COVID was a part of that. And as we always said, there's several lines on that death certificate. So they'll fill all four of those lines in. So something to represent whatever heart issue that they had, and also to put COVID on there. So you're exactly right in how that happens.
I wanted to answer someone else. I think her name was Tina, and she asked about false positives on those PCR tests. And that's definitely with what I was talking about. I don't want to call them false positives. I don't know if that's the proper terminology. However, that's exactly what we were talking about on that Times article, is that if the test is turned up if it takes too many cycles to basically say, okay, and after what it is it's sort of an amplification. So you're testing it and then you amplify it X amount of times, and then eventually it's either considered positive, but you say, okay, my threshold is if it gets to 35, it takes 35 times to cycle this through, then I'm going to consider it positive. Well, if that's higher than that, if a lab says it's 40 or 37, and they might be taking trace amounts of the virus and amplifying it and then calling it positive. But that's exactly the problem, is that person could have just trace amounts in there or just hasn't been infectious for quite some time.
Yeah, one of the big things, this is a brand new situation. You know, we're learning as we go with a lot of this stuff, trying to understand COVID. And the good thing is, as we in Arizona learned as things went, we were better able to protect those who were really in danger, those with comorbidities, those who were over 65, those groups that were in those categories that would have a higher chance of not surviving something like this. All right. Brian Tillman was still here and writes, thank you. So you're so welcome. Glad we could kind of update you. I know we didn't have a specific number on that, but I'll try to see if there's anything else coming out, and then be sure to mark that down so I can update you the next time we join back together on this. Let's see, Garrett, any other things? We're already kind of, the time goes by so quickly as we start chatting on here. Was there anything else that you wanted to touch on with those hospital numbers? I know we went through things kind of quickly, and then we did have a couple questions on kids. So don't let me forget to get the numbers on under 20.
No, we haven't seen anything to indicate that hospitalizations are increasing or in danger of increasing. The COVID-like illness syndromic surveillance system on Sunday recalculated, and it's even lower than it was. So as of right now, at least it looks like everything is stable and going down in the hospital systems. The one question, of course, is the emergency department visits. They're not going up. They're just sort of, they've sort of hit a floor. But that's, until we start seeing an actual increase in there, I'm not really concerned, because it's been like that for several weeks now, having this floor. So, we'll just keep watching them. But so far, hospitalization numbers look great.
Yeah. I want to ask some of you on here, I know we have a lot of athletic gym goers on this thread. So I wanted to ask all of you, as you head back to the gym, how it's going. What's working, what's not, what's been a frustration. If you want to leave that in the comments, we're reading those. Just out of curiosity, I myself have not gone back yet. I've been exercising outside, was outside today. For anybody here in Arizona, it's finally nice today. So it was just beautiful to be outside. And I know a lot of people were taking advantage of that. Just curious, what's working, what's not? Are you signing up for time slots? Everybody wearing masks? Are people working out outside instead? How's it going for you? Garrett, just a few minutes ago, we had a question about when we could see some Labor Day numbers, if we did see a bump from Labor Day. And Labor Day would be Monday, coming up on Monday. And then it would be, what, about 2 weeks or 20
Well,
days?
yeah, I mean, let's
beyond that.
Yeah, let's be honest. Most people, if there is something that happens at Labor Day, most people are not going to be heavily symptomatic, so they probably won't test immediately. Mm-hmm. We would start seeing, if for situations where someone is if this occurs, of course, if someone is in dire straits enough that they have to go to the hospital, then we would start seeing that within about 14 days of Labor Day. We might see some increases in testing, but as far as percent positives, but to watch that to see what those numbers look like. It's hard to see with some of the behaviors. A lot of these, these are younger, either asymptomatic or not very symptomatic patients or people that are testing positive in many cases, and they likely just won't go and get a test immediately, but we'll see.
Let's see. Cindy just commented. Cindy, I'm so glad you're here with us today. She was asking, and I'm so glad you left a comment, because your question is, can you remind me where to find the business opening metrics, trying to figure out where to look for numbers for long-term care visitations. I'm so glad you're back with us today, Cindy, because I think it was last week you were asking about this, and I told you it was happening fast and some guidelines were imminent, and they did come out on Friday. You know what? And I wrote them down for you this morning, and now I don't have my sheet in front of me, but I can tell you for memory, what they were saying was the guidelines that came out on Friday is they're going to ask you to go get a COVID test, quarantine for 48 hours, and then go visit your loved one. So any more guidelines coming out of that, go to abc15.com /coronavirus, because I know that we covered it this weekend and we have the information on it there. If you can't find it, I'm going to work to get you more info on it. But I know one of the major metrics that they were asking for is just to come in with a negative COVID test and to have quarantined for 48 hours. So they want that to be a recent test, and they want to make sure that that you've been quarantining before you go see your loved ones. So wanted to update you on that. I'm glad that you're here with us. And then not to forget your question, Cindy's actual question and all of that was, can you remind me where to find the business opening metrics? So Cindy, those come out on Thursday. So nothing's changed since you were here with us last Thursday. Greenlee County would still be good to go in the minimal spread category. The moderate categories include 8 counties: Apache, Cochise, Coconino, La Paz, Maricopa, Navajo, Pima, and Yavapai. And then those substantial counties that are still working to get out of substantial: Gila, Graham, Mojave, Pinal, Santa Cruz, and Yuma. So really glad we could update you on those. And then those don't update again until Thursday.
And it does appear that as of right now, as things are going, it looks like Mojave is probably going to be put into moderate this Thursday. And Pinal is likely to also be put into moderate. We are seeing some interesting numbers in Graham and Gila. We're seeing higher percent positivities. So I don't think I think Graham and Gila are gonna be a while. But those two, Mojave and Pinal, are very likely to flip this next Thursday.
Yeah. Okay, yeah, Cindy's writing, yes, a test that isn't older than 48 hours, but once we reach minimal, we can visit. Okay, Cindy, let me know what county you are in, and then we'll try to keep tracking that for you. Greenlee would be the only county then, if that's the case, in that minimal category. So I see why you're interested in that. Let me know what county you're in too, and we'll track that over these coming weeks. Wow, a lot of masking comments on the gym. So fascinating. Okay, let's see. Some people aren't liking it. Some people are loving it. Clean and masked. Been going every day, wearing a mask. Orange Theory doing an excellent job. Everyone's wearing a mask. Studio's clean. Great news, Carrie. Good. Glad to see it. Carol writes, my grandson started back at EOS in Tempe. He said the gym's fantastic with distancing, cleaning, spacing appointments. He's pleased. Hey, Carol, that's really good news, because EOS was one of the first gyms to even get approved. They had said, they were so forward thinking in this, Garrett. They said, we know that there's going to be a long list of businesses. We better go have our application in. So they were like one of the first businesses. Yeah. How forward thinking of them to be like, we know there's going to be a line. We know it's going to take time for them to get through this list. The second it's up, they just sat there at the ready to turn that application in, and it really paid off for them. They were one of the first. So really good news there.
I had a couple of people ask about Yuma. So it looks like Yuma is going to be about 2 weeks at the least right now. Their per capita rate of weekly infections is still fairly high, but it's dropping. So it could definitely be at least not this Thursday, but possibly next Thursday.
Okay, good news. Oh, so a week from this Thursday? So
yes.
A week and a half? Oh.
Yeah. I guess a week and a half now, right? Yeah.
Yeah, because it'll be a week and 3 days. Okay, good news. Okay, Cindy's writing, Maricopa County. Thanks so much. I'll get a test as often as needed. What a pain. My only tip, Cindy, is go get the ASU test, the saliva test. That's what I did. It's so easy. It is cake. I'm not a fan of the nose thing. But the Go do the saliva one. That's probably the easiest one. And then we'll keep you updated. Of course, Maricopa County being the most populous, we'll definitely keep you updated as we get closer to that minimal category. Okay, last few minutes here.
I mean, we have had a slight increase in percent positivity in Maricopa County coming up in the next week or so, but it has not gone past, at least right now, it's still within the threshold. It's still under what it needs to be, but it has increased a tiny bit from last week. So, but again, it's a tiny bit. So we'll watch it. It's probably the number of tests are completely full, and it's not going to change. But again, we have to watch what happens this week to see what this next week does. But slight increase, but still on track in Maricopa County. For
sure. Vanessa writes, masks on a treadmill. Oh my God. I know, Vanessa, I'm with you. I would probably put a mask on to go lift, but I would just rather do my cardio outside and not have to. I hear you. All right. Schools close to, Lana asks, schools close to in person yet? So some of them are meeting that, and you'll want to look at the map for the school dashboard map if you're talking about, I'm assuming you're in Maricopa County. Let me just put that out there first. Assuming you're in Maricopa County, you can look at the school's dashboard map. That's where I would go. And we can put that address up on the screen. We won't go into everything on there. We spent a lot of time on it last week, but that'll also be updated on Thursday. So we wanted to keep her updated on that. All right. Oh, Chris, thank you. First time. Chris writes, I really like that you folks are bringing us these discussions and information to a forum like this. First time visiting, really great. Chris, we welcome you in. Thanks for that comment. Yeah, the reason why we do this each day is just to help people find the information faster. I can't stand when I go on a website and I'm like searching all over, or I'm looking at it on my phone and it's this tiny. I love that we're able to kind of stare at these websites all day for you and then help you find the information even faster and tell you where to find it so that you can be able to look on your own at your leisure. And as I always say, I'll say for Chris as a first timer here, first of all, thank you. And secondly, we're never here to make decisions for you. We're just here to help you find the data. So anything we can help you find numbers wise, we're here for you. We're your people. We got you covered. So just let us know whatever you're looking for. But Chris, thank you for joining us for the first time. All right, Carol writes, thank you, Katie and Garrett, for everything you do, giving us all the information and time and all the research. You're both fantastic. God bless you. Stay safe. Same to you, Carol. Thanks for joining us. Love seeing your name on here. Hope it helps. Hope it helps you to find that info on here. All right. Boy, the hour is running by. Okay, we're out of time, Garrett. Tuesday is usually a big day, but are those Tuesdays now kind of leveling out and we shouldn't expect...
Yeah, they used to be sort of a bigger day, but we're not really seeing it because things are going down the way they are. We get a good idea of what happened during the weekend. So, I mean, if what I'm waiting for right now, just as a, I don't want to say I'm waiting for those ASU tests to see what ASU looks like. As long as that doesn't sort of start to creep up, then everything should be okay. But that's sort of the only thing I'm really concerned of for tomorrow is ASU.
Some of those numbers. Okay, we will watch that. I want to let you all know it's about 2:20, 2:17. So in 45 minutes, the governor's speaking. I know that a lot of you are like, why don't you tell us any earlier? We don't know any earlier. As soon as he announces that he's going to be talking, we let all of you know, and he's going to be talking at 3 o'clock. So keep your phone close, or we'll have it right there on TV on ABC 15, or we'll have it here on Facebook or on abc15.com so you can get all the very latest information from what they say. We expect him to be there with other leaders from hospitals and pharmacies and public health and universities. And what we really expect is a lot of information on flu vaccination rates and how they're going to be pushing all Arizonans to get a flu shot, especially this year. Even if you don't every other year, they really want you to this year. Think of how confusing it's going to be if you start to feel ill and you don't know if it's the flu or if it's COVID or something else, and you've got to stay home from work, you've got to self-quarantine no matter what. So it's going to be of a big concern this year, and that's what they're going to be really talking about, and that's coming up at 3 o'clock. Woo! All right, Garrett. Hey, if you guys want to find Garrett, he's got even more information, really good data coming out every single morning, and you can find him on Twitter at Garrett_Archer. I'm also on Twitter at Katie Raml is the best place to find me. And then also over on Facebook, as I always say, I've seen so many of your names show up on my Facebook page, and it's great because we can continue the conversation over there. That is facebook.com/news from Katie. We've got reporters stretched out all over the valley to get you the very latest information, everything that's coming in today. Data guru rules, JD writes. Love that. Nice way to end, JD. Thank you. Let's see. We're going to have our reporter at that news conference, so we'll get you all the information if you miss it right here. We'll, of course, have all our reporters, as I mentioned, stretched out all across the valley to bring you the very latest information. You can find our newscasts at 4, 5, 6, and 10 p.m. And as always, we always join all of you right here each afternoon. And so we'll see you back here tomorrow. Bring your questions, post them in the comments tomorrow, and we will update you on the information that we can find for you. Arizona numbers as it pertains to the coronavirus. Be safe out there, everybody.